Hi guys, and welcome to my channel. My name is Sanelisom Tembo, and today I'm going to be talking about something important, something different, something that I think that people should be like paying more attention to, like raising awareness, especially as students. I'm sorry, my camera just moved from where I had placed it. Okay, it's fine now. Okay, what I want to talk about is ADHD. Something that people don't necessarily pay attention to, especially if you are students, because you're mostly affected, you know. And as an adult, because ADHD, I'm so sorry, because ADHD is like likely to affect people from the ages of 7 about, so it's like 70% from childhood. So ADHD is like attention deficit hyperactivity disorder, which is ADHD, which affects up to 70% of adults who were diagnosed as children with this disorder. ADHD is chronic developmental condition, which is that is characterized by problems such as sustained attention, impulse control, and regulation on self to the demands of an activity. So it is very much important to know that ADHD is like normally first diagnosed in childhood, where symptoms, have been present before the age of 7. Maybe you can symptoms are maybe you can like start noticing them at like 5, 6, 7, yeah, and it just persists into adulthood. And if it is left, improperly or like poorly managed or treated, so it's gonna affect you on your adulthood. Our so ADHD in like university, that adults with ADHD often like have difficulties like when it comes to social situations and experience challenges related to like communication in both like their personal lives and like professional or academic lives. So an individual with like ADHD may experience like a lot of difficulties when it comes to their life. A lot of things such as poor sleeping habits, more failed courses, like you will find yourself ending up failing like more courses, failing modules, repeating modules, spending more time now, adding more years now in university, and then you find that you do not even have funding. So you do not even like have someone to pay for your studies, so you end up losing funding because you keep on failing. You often get memory loss problems, impulsivity, procrastination, low self-esteem. You end up not like being confident about yourself. You end up not being being confident about your studies. You get like underachievement, like, and get poor grades, and that's like very much embarrassing. And you'll find that it's not like you, it's this ADHD that you are not paying attention to it. So but despite the hyperactive and impulsive behaviors, individuals with the ADHD like may also experience other emotional and academic related difficulties, such as anxiety, conduct disorder, or a specific learning ability. So you need to like diagnose ADHD, which is mostly done by like professionals such as psychologists, psychiatrists, and the GPs. Okay, I'm so sorry I got disturbed. um, um, okay, I was saying that the diagnosing of the ADHD is done by a head professional or a psychologist. So these professionals are like fully trained to like assess and identify the symptoms, um, behaviors, using the psychological tools and assessments and other information gathered from you as an individual who has like ADHD. So your family members may also like give out information to your psychiatrist, maybe on the things that you do, your behavior, maybe you're isolating yourself, maybe you get anxiety, depressed, I mean. So adults who like often do not really understand or recognize the symptoms of ADHD. I'm looking at the time here because it's on 5 minutes now, and I don't want this to be long. So adults that often like not really understand or recognize the symptoms of ADHD may usually like seek treatments from other difficulties that are discovering that the ADHD is the cause of their difficulties. You see, so you don't want ADHD to add up to your problems. So you have to like see a psychiatrist, but there's also something that's it's like ADHD versus poor concentration and varsity, because my main focus here is in varsity because I'm a student, and I see a lot of people that are struggling with anxiety. So ADHD versus poor concentration. As you know, that ADHD is like a disorder that is present in childhood, and it is characterized by impulsivity, reckless, like being reckless, Jay, when you are a kid, being hyperactive, or being this person that always interrupts others, or being an excessive talker. I don't know if I'm an excessive talker because I talk a lot, but not listening to instructions, being easily bored. You're not supposed to be someone that's easily bored. So and lack of concentration too. It is very much important to know that everyone can experience these symptoms or anytime, and it does not necessarily mean that you have like ADHD. So what can you do with? So what can you do to like help overcome some of these problems and expand your concentration span? So different people often like have different amounts of time which can concentrate for, and you need to find a hobby, do something, see a psychiatrist, and you need to stop like being an overthinker. Take a break. Don't worry about a lot of stuff, and just know that ADHD can be treated, and you just need to you know what they say, that the first step is admitting that you have an issue, and then you seek for help. I hope that this video is going to help a lot of students, and I'm looking forward to uploading a next video where I'll be talking about procrastination and examination anxiety. Thank you. I hope you have a nice day.